Hello everyone and welcome to another mnemonic video. Please don't forget to subscribe if you are new here, like if this video helps, and suggestions are welcome. You can drop them in the comment section. Let's dig right in. I'll start by talking briefly about the nervous system in general. So we know it is made up of the CNS, central nervous system, and the PNS, which is the peripheral nervous system. The CNS is basically the brain and the spinal cord, and so everything outside the brain and the spinal cord is considered the peripheral nervous system. The peripheral nervous system is made up of the afferents and the efferents, and we know the efferents, we have the autonomic system, which is the parasympathetic and the sympathetic, and the enteric system, which most students tend to forget. And another branch of the efferent nervous system is obviously the somatic system, which controls the skeletal muscles. But today we are just going to zoom in on the sympathetic portion of the nervous system and talk about some drugs that you should know which affects this system the most. And so we know that this system is made up of receptor drug interactions, and so these are the main receptors that we could see in the sympathetic system. We have the alpha drugs and the beta drugs. We know we have alpha 1 and alpha 2, and then beta 1, 2, beta 3. Now beta 3 is not usually clinically relevant, and so most of the time you see beta 1 and beta 2 being talked about in textbooks or wherever you might learn your pharmacology from. I'll continue by talking about some of the things you would see when the sympathetic is active. You know, the sympathetic starts with an S, and so I like to call it the system of speed. And so when imagine you're being chased by a bear, obviously your heart rate would increase, your cardiac muscles will contract faster in order to push in blood to your systems, right? And so when you're being chased by something like a bear, your lungs open much to accommodate or to take in as much air as you can, and so there is bronchodilation, right? And when you're being chased by a bear, imagine how terrifying this bear looks like. You wouldn't have time to poop or to shit, right? And so there is a decrease in gastric emptying. As opposed to the parasympathetic, there's a decrease in gastric emptying and decrease in urination. And so when the sympathetic system, the system of speed, is activated, you see these things in a general sense, okay? And so we have alpha 1 drugs. Now these are the drugs which are selective for the alpha 1 receptor. The mnemonic here is 1 POM, please. And so the 1 here denotes alpha 1. The P here is phenelphrin. So this is an alpha 1 selective drug, phenelphrin. The O here is oxymetazoline, or there is another name for it, it's called xylometazoline. They're basically the same drugs, but the names are a little bit switched up. The last drug that we will talk about here is an M, so we have midodrine. Okay, now the oxymetazoline and xylometazoline, they are basically used as nasal decongestants, right? So nasal decongestants. Okay, and so there you have it, alpha 1 drugs. Just remember 1 POM, please, or just 1 POM. The please here is just to complete the mnemonic. So just 1 POM, 1 being alpha 1, and the rest follows. Alpha 2 here, this is a classic drug you should know, which is clonidine, right? There's no mnemonic for it because it's pretty easy. You could memorize it simply. So clonidine is usually used in ADHD. Now what is really interesting about this alpha 2 receptor, or the alpha 2 drugs that act on this receptor, is that we know, like I said, the alpha 2 is a system of speed and S, right? But this drug, or this alpha 2 receptor, tend to oppose the action of the sympathetic, which is the speed. Okay, most of the time we know that there is a release of norepinephrine from this sympathetic system. This is the main neurotransmitter. We know we have epinephrine, but norepinephrine is the main one. And so when some of these norepinephrine binds to the alpha 2 receptor, what it does is it inhibits the release of subsequent norepinephrine. And so we have this drug, a drug which has been modified to selectively bind to the alpha 2 receptors. and when it binds, it inhibits the release of further norepinephrine, and so it opposes the action of the sympathetic system. Next, let's talk about beta 1 and beta 2 drugs. And so let's talk about the mnemonic first. So the mnemonic is do-buta-1 and beta 2 sats. Do-buta-1 and beta 2 sats. I know it's a kind of a messed up English, but hey, it's a mnemonic, anything goes. I mean, not anything exactly, but you know what I mean, right? So the first drug we have here, we know that these the first two words are in vowels, right? And so the first drug is dobutamine, so it's kind of in the name. Okay, so dobuta-1, we get dobutamine. Let me write it well. Dobutamine. Okay, so you can get a little bit of beta 1, the name beta 1 inside. That's why I made it dobuta-1 and beta 2 sat. Now let's go to the drugs which are specific for beta 2 receptors. Okay, so we have beta 2 sats, right? So the drugs are in the word sat, and so they bind to beta 2 receptors. Now, how do you remember where the beta 1 and beta 2 receptors are found? Now we have one heart, right? And so beta 1 receptors are found there, and we have 2 lungs, and so we have beta 2. So one heart, beta 1, 2 lungs, beta 2, right? So you should keep that straight. You're probably asking yourself, what does this SAT mean? Now the first drug here is, let me wipe this off. The first drug here is salmeterol. Okay, the second here is albuterol, and the last one here is terbutaline. Mostly these drugs are used in the treatment of asthma, right? Asthma, because of these, they are bronchodilatory effects. Let's continue with drugs that have both alpha and beta activities. Now the ones that we talked up here, this is drug specific to beta 1 and the drug specific to beta 2. It does not mean that the same drugs can act on beta 1 and beta 2. No, beta 1 is only dobutamine, beta 2 is the salmeterol, albuterol, terbutaline, right? So specificity you should know. Now when I say alpha and beta activity, this is just there's one drug that can both that has influence on alpha and beta activity at the same time. Okay, now let's look at the popular drug norepinephrine, or what some people like to call noradrenaline. Norepinephrine. So I wrote na-epinephrine. Na-epinephrine. It's like saying na is like a slang for no. Okay, anyway, that's not really important. So the way I made it should tell you that na-epinephrine or norepinephrine, you know, they kind of sound the same. So na-epinephrine, and so norepinephrine has alpha 1 activity which is greater than any beta activity. Na-epinephrine, so alpha 1 activity is greater than beta 2 activity, and so most of the time when you take in a bolus of norepinephrine, you see the drug binding more to alpha 1 than beta receptors. So na-epinephrine sounds like norepinephrine. You can link them as alpha 1 greater than beta 2. Now let's move on to epinephrine or adrenaline. And so we think of epinephrine as the opposite of norepinephrine, right? And so if norepinephrine has alpha 1 greater than beta activity, we just switch it, right? And we say epinephrine has beta 1, beta 2 activity which is greater than alpha 1. And so when you know the activity of na-epinephrine, you just take the opposite of na-epinephrine and you get your epinephrine. And so at lower doses, when you give a lower doses of this drug, you get beta 1, beta 2 activity. And so we can most of the time we use this drug in treating anaphylaxis. Anaphylaxis is it's a life-threatening reaction to maybe bee sting or sometimes some foods like peanuts and others. Okay, and we can also use this drug in cardiac arrest. And so when you get an MCQ question and they ask you which drug is preferred for the treatment of cardiac arrest, it's not norepinephrine, it's epinephrine, because of its beta 1 beta 2 activity, which is greater than alpha 1 activity. Let's finish this mnemonic video with isoproterenol. I didn't forget it. I know it's kind of messed up in the writings over here. And so isoproterenol, it has beta 1 and beta 2 activity. So it binds to beta 1 and beta 2 receptors. And so we know beta 1 is found primarily in the heart, because we have one heart. Beta 2 receptors are found in the lungs, because we have 2 lungs, right? And so how do you remember? Now we have 2 E's here, 2 E's, and so beta 1 plus beta 2, we know there are 2 E's in this this word, right? These words. So isoproterenol has beta 1 and beta 2 activities. Well, ladies and gentlemen, that's all for this mnemonic video. But wait, we have one question that you need to solve to see how much you understand this basic concept. So stay tuned. We have a clinical vignette here. Let's dig right in. A 78-year-old woman presented the ER unconscious. The emergency medical technician reported that she was eating at a restaurant with her daughter when she apparently grabbed her chest and promptly passed out. A random strip demonstrated that the patient is in torsal depoint. Torsal depoint can be caused by certain medications like class 1A antiarrhythmics and a little bit of some class 3 antiarrhythmics, but let's move on. You immediately begin the appropriate ACLS protocol. That's the Advanced Cardiac Life Support Protocol. Sorry about that. In hopes of saving this woman's life, as you are directing the resuscitation of this patient, a medical student asks whether you will be employing the use of a certain drug that acts as a potent beta 1 and beta 2 receptor agonist. You explain to the medical student that the drug that she's speaking of is indeed a drug that can be used to treat torsal depoint in conjunction with magnesium and override pacing. Okay, so our buzzword here is a beta 1 and beta 2 receptor agonist. And from the mnemonic, we said that a certain drug, isoproterenol, because it has 2 E's, it is a beta 1 and beta 2 agonist. And so the drug of choice here is isoproterenol. I'm sure you paused the video and answered. Do not cheat. Next question. Second clinical vignette. A 24-year-old woman is brought to the ER unconscious. According to the emergency medical technician report, she had been eating at a Thai restaurant with a group of friends when she suddenly began to complain of trouble breathing and then quickly lost consciousness. An ambulance was called and the patient was intubated in the field. Physical examination reveals the presence of hives and poor air movement. You also find a medic alert bracelet on the woman, which states that she is allergic to peanuts. Buzzword: peanuts. You diagnose her with anaphylaxis, right? Okay, so it's been mentioned. And immediately administer a low dose of a specific medication. Another buzzword: a low dose of a specific medication that will hopefully relieve her bronchospasm. Okay, so pause the video and answer the question. What is the answer to this question? The answer to this question is epinephrine. From the mnemonic, I told you that epinephrine is specifically used for the treatment of cardiac arrest and anaphylactic shock, right? Anaphylactic shock. And so this patient clearly was said to have anaphylaxis in the question, and so the drug of choice that you should have chosen is epinephrine. And why do we choose epinephrine? Obviously, we said epinephrine, which is epinephrine, has alpha 1 greater than beta 2, and we take the opposite of that, we get what? Beta 1, beta 2 greater than alpha for epinephrine, right? And so anaphylactic shock is causes severe bronchoconstriction, and so we could see that the patient was having trouble breathing. And if the patient is having trouble breathing, the drug that was given in low doses. Here low doses is alpha 1 for epinephrine. Epinephrine low doses is beta 1, beta 2. Like I said, beta 1 is what? Heart. Beta 2 is what? Lungs. We got 2 lungs, and so the drug that will promote air breathing, that's bronchodilation, is clearly epinephrine. I'll see you in the next one. Don't forget to subscribe.